Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. This briefing will address holiday preparations and traveling, how to safely celebrate during the pandemic. For more than 9 months, the COVID-19 pandemic has significantly disrupted normal lives and livelihoods. Now, many family members and friends are yearning for the closeness of holiday get-togethers. But this year is different, and now we must seriously weigh options we've never had to consider. Am I healthy enough to travel, or is my family member? Is it safe enough to fly? Do we need to get COVID tests first? Should we quarantine before or after our travel? Are there travel restrictions in place? Should we stay home? If we do gather together, should we stay outside and at a distance? Is seeing my family and friends worth the risk? This afternoon, our experts will bring a science-based and engaging perspective on a topic so pertinent to many after a tough year with the COVID-19 pandemic. And as we approach holidays, when many of us have questions on whether to travel and how to celebrate, together at a distance, when and where to mask, and whether to share meals or not. Please note that participants are welcome to use images, video, or quotes directly from the webcast, and that the content is for immediate release. First, I'd like to briefly introduce our two speakers. Dr. Amesh Adalja is Senior Scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health and a practicing physician in Pennsylvania. During the pandemic, Dr. Adalja has been emphasizing the importance of testing, community transmission, potential vaccines, and therapeutics, as well as risk tolerance. Dr. Keri Althoff is an associate professor in the Department of Epidemiology at the Johns Hopkins Bloomberg School of Public Health. She also serves as the Provost Fellow for Research Communication at Johns Hopkins. During the pandemic, Dr. Althoff has been engaged in research initiating large-scale cohorts of people with and without COVID and seroprevalence of SARS-CoV-2 antibodies. She has been also focused on translating evidence and safety guidance for families. We will have time for questions following our panelists' remarks. The procedure will be as follows. We will take some questions that have been submitted in advance of the briefing and some questions from the Zoom chat. If you have a question during the briefing, you can enter it in the Zoom chat addressed to all panelists. Please enter your name, media outlet, and question. We hope to cover as many as possible. Just a note that participants will be muted during this briefing and it will be recorded. Dr. Adalja, please go ahead. Dr. Adalja, you'll have to unmute.
Thank you for that introduction, and thank you for coming to this event. So in my remarks, I really want to just focus on how to think about this holiday, think about other holidays, other events that you do. And I think the number one thing that needs to be understood is your risk tolerance. And we know that people have different types of risk tolerance. Some people are much more risk averse than others. Others are more risk tolerant. And that's the first thing you have to think about when you're thinking about a Thanksgiving get together. What is the risk tolerance of everybody going there? Are there people with high risk factors for severe disease? And is everybody on the same page before you go? Because you know, in this pandemic, with community spread going the way it is, that no activity is going to be without risk. You cannot get the risk down to zero, but you can take some common sense precautions that will minimize that risk. And I think we have to borrow from other parts of public health, from sexually transmitted infections, from injection drug use. We talk about a concept called harm reduction, knowing that people are going to take risks, but working with them, meeting them where they are to try and give them a toolkit to think, how can I get this risk lower than what it is right now? So some of the things we can think about is think about who's coming to your event. If you're having a Thanksgiving dinner, are people coming that you haven't or haven't mixed with? Are people coming from places of the country like North Dakota or South Dakota where there is a lot of cases? And then how are they going to actually get to your state if there are restrictions, for example, for travel to that state that's non-essential? Do they have to get a test? Do they have to quarantine? All of that needs to be thought about ahead of time. Then you have to think about what is the size of the gathering. The bigger the size, the more likely that the virus is going to be sitting around that table with you and your guests. And if you can invite people that are sort of from different households, the more households you invite, the more the risk is going to be. Then you have to kind of move forward and think about logistically how this happens. Are you in a place where you can do things outdoors? Are you in a place where you can open a window? Because anything that mimics the outdoors is going to lower the risk. Can you make little virtual pods in your Thanksgiving get together? Can families or households that are already mixed, can they stay mostly together? And then you have other people wear face coverings, masks, face shields when they're interacting with other people. Can you try and keep people 6 feet apart? All of that is what you have to sort of work out and try and get everybody to think about this ahead of time. Check in with people before the event to make sure nobody has gotten symptoms, nobody's gotten exposed. If people get tested, yes, you can decrease the risk, but remember, testing is not ironclad. We saw that what happened at the White House with testing. And remember that logistically, testing can be very difficult in different parts of the states in this country. Some places you may get a test, you might not get a test result back for 4 or 5 days, which makes it very hard to do. So I think that all of this kind of gives you sort of a way to come up with a risk calculus to try and move forward. And I think that in general, Americans haven't had to make these kind of risk calculations for a long time. Not probably before the measles vaccine or the advent of penicillin was there some infectious disease threat with every one of their activities. But I think the best approach is to think of one of trying to use this harm reduction principle, trying to meet people where they are and give people a toolkit that allows them to move forward and enjoy some of these things, knowing that there is some risk and that there are some common sense precautions you can do in order to make it a little bit safer. So thank you.
Thank you, Dr. Adalja. Now we will hear from Dr. Althoff. Dr. Althoff, please go ahead.
So thank you all for being here today and playing this important role in helping to ensure that all people in our country have the access to information that they need. Because to have enjoyable celebrations, it will take planning and innovation and choosing lower risk options so that hopefully we can reduce the likelihood of a post-holiday spike in cases, hospitalizations, and deaths from COVID-19, which may result in state level interventions to quell spikes and possibly slow the recovery of our livelihoods. So holiday travel should be carefully considered. Staying at home is the lowest risk. Driving in a personal vehicle can be less risky than flying or taking a bus or a train. Although evidence does suggest air circulated in planes is not the biggest threat, crowded airports with lots of high-touch surfaces are high risk. Be sure to practice your statement of how you will encourage more distance between yourself and a stranger when you are in line to check in, head through security, or board the plane. Wear your mask, sanitize and wash your hands frequently. Be ready to accept abrupt changes to your travel plans. Do not travel if you feel unwell, if you are awaiting COVID test results, or if you're in quarantine after a close contact with someone who has had COVID. Review states' policies for quarantining of visitors from other states, and also know your home state's policies on quarantining for your return, as well as the policies of your employer, your daycare provider, or your school. So perhaps this year we'll find other things to do that is very enjoyable, that enjoying our friends and our family virtually, or perhaps connecting in our own households with our friends and our family instead of the holiday hustle and bustle. Given the evidence of household transmission in small gatherings, it's very important to remember that small gathering is an important driver of this epidemic. So a celebration should be limited to your household as the lowest risk option, particularly in communities with a high number of cases. But if you are planning a face-to-face gathering, gather your guests on a virtual platform before that gathering and talk about the goals and the ground rules of your gathering together so everyone's on the same page. If you are going to have other individuals into your home, really reduce the number of individuals and the number of households that are coming into your home. Perhaps you're going to prioritize a loved one who's pretty isolated and you're going to take precautions before interacting with them in order to keep them safe. As a note, today is the 2-week mark prior to Thanksgiving. So if you are planning a gathering in person, you and your guests should be on the same page and everybody should be really starting to reduce their exposures today. The day before the event, the host should definitely call the guests and ensure that there has not been a diagnosis of COVID-19 symptoms or anyone's awaiting test results or exposure to someone with COVID in the last 14 days. Find a way to connect with yourself find a way to connect yourself to your wider network of family and friends by ensuring that your celebration is meaningful. Make sure the different households that you connect to on a virtual platform are sharing the same dish, or perhaps you're making cards for those who you cannot see in person. Maybe you have a drive-by parade to wave hello to grandparents. Those individuals who are at higher risk, who may choose to stay home, we need to reach into them and their safe accommodations in order to know that they are thought about and connected, but also keeping that space so that we keep them safe. Outdoors is definitely better than indoors for a gathering. If you have to be indoors, do open the windows, turn on fans, increase ventilation, turn on your central AC or heating for that continuous circulation, and remind guests that they may need to dress in layers as it might be drafty. Remember that the celebration may be just one single event, but it's actually the 14 days before. You're bringing all those exposures with you to that event. And also be sure you remember that in the 14 days after, you'll need to be monitoring very closely for any symptoms. And if someone does get symptomatic after the event, there should be a plan in place before the event for who will be called and whose job it will be to call the other guests to let them know what has happened. Remember that quarantine and isolation are important key tools in combating this epidemic. So the holidays should be celebrated this year to help us all regain our strength, to recover, to rest, and reconnect. We need to re-energize in new ways and connecting in new ways to avoid those moderate and high-risk COVID-19 environments. And remember that we will be telling stories from these holidays for generations to come. So make sure you do something memorable.
Thank you, Dr. Althoff. Now we will take questions. If you have a question, just a reminder, please enter it in the Zoom chat with your name, media outlet, question, and to whom you'd like to address your question. I'd like to start with these questions from Lauren Zumbach from the Chicago Tribune for Dr. Althoff. The Department of Defense and United Airlines recently released a study suggesting that the risk of contracting COVID-19 during an airline flight is not particularly high. What's your take on the methodology and findings of that study?
So the findings of that study were really focused on that circulating air, but really the greatest risk when you're traveling may not be the circulating air in the airplane. It may be the standing in lines. It may be challenging to keep 6 feet of space. It may be just a simple fact that you'll want to adjust your mask. You got to keep your hands down and out of your face. There will be bathrooms. There will be high touch areas. Traveling is a whole experience, even just getting to and from the airport in whatever transportation you choose to take. So it's not just what's going on in the airplane, but it's the whole experience. And so doing everything you can to reduce your exposures if you do choose to travel, or given the quickest acceleration of new cases in the country right now, choosing to stay home may be the best option.
Thank you. And a follow-up to that is, if someone is planning a trip and evaluating options like different bus companies, trains, or airlines, what kind of information should they look for to understand the risks and choose among the options?
So this is a great question. Things to look for, questions to ask. Are you operating at full capacity? Will there be a seat between me or some sort of space around me and the next person? How does the company describe the precautions that they are taking? What do recent reviews of other passengers say about their travel experience with these companies? Really doing some information digging before you engage with travel will help you know exactly what to expect and come prepared, or it may help you make a different decision.
Thank you. And a third one in that series for both airlines and buses, some companies, just to get back to the point about the empty seat next to them, does that really matter?
So social distancing matters. That's a fact. Social distancing matters. A seat between you and someone who could potentially be infected with COVID is safer than having someone right next to you for the duration of the travel.
Great, thank you. Here are 2 questions from Eric Sarkisian from Politico for Dr. Adalja. How will holiday travel impact big vacation destinations such as Florida? And a follow-up, will influx of holiday visitors lead to another wave of new infections?
Holiday travel is going to be severely disrupted by this pandemic. We know that people like to go to warmer climates when it is colder, but there's going to be a lot of difficulty with trying to get from one state to another, because there are quarantine rules. There are going to be difficulties with needing a test to get out of quarantine. There's going to be the question of how do you get back, and what do you do when you get back? Do you have to quarantine? Do you have to get a test? This is going to be something that makes it very hard. And I actually advise people not to necessarily go on those types of vacations when you're going to a state that may be farther away that you can't get to in order to avoid those quarantine type of restrictions. And I do think that the other issue is that what you have to think about is that when you do that there are different prevalences of infection in different parts of the country, and that's going to be the norm. So all kinds of travel is going to be much, much, much more disrupted when you do this. And then the other issue is that many places have controlled the infection. So if you're looking at Vermont, for example, if you go to Vermont, you do run that risk of bringing the infection with you and seeding an outbreak there. And we've seen this already in college towns, like in State College, for example, in Pennsylvania, where I live. There's a lot of concern about what's happening on the campus impacting the population of the town. And that's something that I think every small town, every tourist destination has to think about. It's not just the tourism revenue that you're losing. It's also the fact that you have to worry about your own population, and maybe a small hospital that's there, for example, like we have in State College in Pennsylvania, that can get inundated very quickly because of people coming from another part of the country and start setting off a chain of transmission. So these are very complicated issues. And I usually advise people against going to those places where the virus is uncontrolled because of that very reason.
Thank you so much. Here's a question from David Shaper from NPR for Dr. Althoff. Regardless of how safe it may be on a plane, is it really responsible to be promoting air travel right now with the huge numbers of new COVID cases we're seeing in so many parts of the country?
So, as you imply, airports are places where people from all over are mixing, including people from communities with high levels of transmission. And as we see day by day, the number of cases going up in so many states across our country, it's pretty clear we're in acceleration right now of this next wave. So everyone's risk tolerance is different, but people must take the information on what a low, mid, and high risk environment look like and make the best decisions for themselves and their families and their communities. Personally, I am not traveling this year.
Great, thank you so much. For Dr. Adalja, here's a question from Francis Deep at the Chronicle of Higher Education. Do you have any recommendations for colleges and universities who have had students on campus and will soon send those students home for Thanksgiving? Should institutions test all of their students before Thanksgiving?
Ideally, if we were in a situation where people could be tested at will, this would be one way out of it, that we all know our status at all times and then can use that in order to decide what actions we take and don't take. But that's not the world that we live in right now. And this is going to be something that's going to not have a one-size-fits-all answer, because each college student does things differently. Some people may be very isolated and not exposing themselves. Others may be going to clandestine fraternity parties and they're going to pose a risk. So you should think about any college student basically coming home, for the most part, should be thought of as a high-risk contact, that person you should be already thinking about before they come home, limiting their contacts, as Dr. Althoff talked about, just for going to Thanksgiving. The same is true for college students coming home. Start thinking about limiting their contact. If tests are available, that can somewhat decrease the risk, but it's not ironclad. Think about who's in your household that they're going to. Is this a multi-generational household which has elderly people or individuals with high-risk conditions? That's going to make it a little bit more difficult. Think about then if who's going to come visit that person, what their behavior is going to be like when they come back. Just all of that has to be part of the risk calculation that you do. And there's not an easy answer. And we know early on in March, when in New York City, in New York, for example, where colleges were closed, there was some concern that bringing all those college students home to vulnerable parents and grandparents and communities might not have been the best decision. So this is something that I don't think there is a perfect answer to, but again, it's all about risk tolerance and thinking about ways that you can minimize it. And I do think that those individuals should be overall thought of as high-risk contacts and should be mindful for at least 14 days after they return back to their hometowns.
Great, thank you. Here's another question for you, Dr. Adalja, from Robert Lang at WBAL Radio. For a state like Maryland, where you are advised to avoid traveling to 35 states that either have high positivity or infection rate, do you even travel at all for Thanksgiving? And what about Christmas?
If you're in a state where there's a lot of restrictions on where you can and can't go, and you want to stay, don't want to run afoul of the law, I think it becomes advisable probably not to travel and come up with alternative plans. Because if you end up going to these states, just like we alluded to earlier, where there's different prevalences, you run the risk of bringing this virus back and getting exposed to it. So I do think if you're in one of those states where there are aggressive quarantines and aggressive restrictions on your travel, it may make sense not to actually cross those state borders, or try and see if there are states that are open that you're able to go to. Look at the rules. Sometimes it says if you're just traveling through a state, it doesn't necessarily apply to you. It's if you're there for more than 24 hours. So I would look at those in detail. But in general, when you're traveling to states where there's high prevalence, it's always going to be a risky proposition and a logistical nightmare to make sure that you're in compliance on both sides of the border.
Great. And Dr. Althoff, back to traveling. What do you do in a situation if you're in a crowded line or a crowded airport shuttle?
These are tough questions. And I think the thing you have to be prepared for if you make the choice to travel, that you could be in a situation like that. So that should go into your calculation, into your decision making about whether or not you want to run that risk. Of course, when you're traveling, wearing a mask at all times, keeping your hands away from your face, washing your hands, having your hand sanitizer with you, because when you do get into these situations, it may be very uncomfortable and you may not have another recourse. You may have to ride that shuttle to the terminal and then get out and move around a little bit. So I think, everybody has a different level of comfort with that. And we do know that when you are packed together in smaller spaces, the virus does have a bit better job at transmitting. Masks are really important. And of course, as soon as you get off that enclosed space, move around as much as you can, get away from other people.
And here are some questions from Sam Lisker from Spectrum News for either of you. Lots of families are buying space heaters to host gatherings outdoors. Is it really more safe for families to gather outside than indoors?
I can take this question. It really is more safe to be outdoors. Doesn't mean that we shouldn't be wearing masks or we could forget about some of our other principles like masks and social distancing. We still need to practice those. But being outside is much better than being inside when it comes to just putting up another barrier for that virus to transmit. So I really think being outside is a good idea right now, especially for families. There are space heaters. There are a lot less expensive options as well. Making sure that your family members have a good coat, contacting loved ones or neighbors like I do when my kids grow out of their things. Hey, does anybody have a 2T or 3T pair of snow pants? Those types of things to make sure that your family members can be outside, enjoy some fresh air, even in less than ideal weather, will be really important this winter.
Great. And here's a question for you, Dr. Adalja, from Saba Aziz at Global News Canada. WHO, the World Health Organization, says the coronavirus is not affected by the weather. If that is the case, why is there a greater concern of its spread during colder months?
So this is a little bit of controversy. And I think you have to look back at coronaviruses as a family. And if you look at it, look at them. Remember, this is the 7th human coronavirus we've discovered. 4 of those coronaviruses cause about 25% of our common colds. And those coronaviruses exhibit a very stark seasonality. So there's a lot of biological reasons to believe that this coronavirus does have some seasonality. It's just that we never saw a suppression in the summer because when you think about how the weather influences transmission, one of the main ways is surface transmission. And we already know for this coronavirus that surface transmission is a secondary means of transmission. But it is true that when it gets hotter, when it gets sunnier, when it is more humid, the virus finds itself in a constrained situation. However, there is no population immunity to this virus. So I think it overcomes that in a way that didn't allow us to see that seasonality. But it is clear as it's getting colder that acceleration of transmission is occurring. And it is true that other coronaviruses do see this spike in the winter. And whether that is due to biological characteristics or the changes in our behavior that in many parts of this country, we have to move indoors and because it's too cold to do these activities. And we know, just as Dr. Althoff just said, that this virus transmits more efficiently indoors. So that also may be part of it. And then we also have pandemic fatigue occurring. So there's a bunch of different multiple factors that are actually responsible for why this virus is probably increasing now. But I do think that as we get more experience with this virus, as we get some level of immunity to this virus, as we start to see how this virus would behave were it not a brand new virus, I do think it'll probably track with the other coronaviruses and have a seasonality. It's just that it's so early, you're not necessarily seeing that seasonality. And no one was around that really when those other coronaviruses jumped into humans to see how long it took them to get into that seasonal pattern.
Another question for you, Dr. Adalja, from Anna Elena Azapura from Univision. Have you noticed a correlation between previous holidays, Memorial Day, the 4th of July, Mother's Day, Halloween, and an increase of cases 10 to 14 days after?
Definitely, that's been the case, that we see people get together and they use holidays as an excuse to socially interact. And then we see some spikes. Some of the spikes are bigger than others, but there's always been a spike. So just here right now, I'm in Allegheny County, which is where Pittsburgh is. And you probably all heard about it and watched it because of the presidential election, but that's where we are in Allegheny County right now. And we're seeing a major spike. We had over 400 cases today. And most of the case contact data shows that these came from Halloween gatherings that were occurring at people's houses. So there definitely is this phenomenon where people use holidays as an excuse to get together. And that does lead to transmission. Any type of social interaction, the virus is going to be with you. And we should expect to see there will be a spike after each of those. Whether or not that spike is sustained or whether it's something that we can control, that's the key question with public health infrastructure. Do we have enough contact tracers to be able to intervene?
Great, thank you. Here's a question for you, Dr. Althoff, from Sam Lisker of Spectra News, DC. Can getting the flu vaccine help fight the COVID-19 pandemic?
It definitely can. Getting the flu vaccine is highly recommended this year for everyone who's able to get the vaccine. The reason why is because the flu vaccine does help keep people out of the hospital with flu. And as we've been saying, that the hospitalization rates are ticking up. And, we do know that the hospitalization trajectory lags behind the number of new cases by about 10 to 14 days. So we are really paying attention to how we can reduce the number of people who are going into the hospital because we need that space for coronavirus and caring for those individuals. So keep yourself out of the hospital, get yourself a flu shot.
Thank you. Dr. Althoff, another question for you. Is it safe if guests bring their own food and drinks?
So for holiday gatherings, this is another aspect where things could look really different. To bring your own food and drinks is a good idea. I think for some people that really detracts from the spirit of, for example, Thanksgiving. But if you decide to have a gathering where you have a couple of families, hopefully you could host it outdoors and you could still stay socially distanced and have your own space with your household to interact. If you move it inside, again, bringing your own food and keeping some distance between yourself and the other households would be a really important way to help reduce the risk of coronavirus transmission.
Here's a question from freelance reporter Catherine Harmon Courage. What would be the safest and riskiest holiday winter activities to do with children, Dr. Althoff?
So I think the safest are just getting them outside, but not in crowded spaces, right? So going for walks. I think my kids will be very experienced in cold weather by the time the winter is over because we need to get outside and continue to enjoy the fresh air. So any outdoor activity where they are able to keep space from others. If you do go hiking in a park or someplace like that, and there is a mask mandate, remember to bring your mask with you, especially when you encounter other people on a hiking trail or something like that. The sports that get more risky even in the wintertime are the sports where kids are going to be in contact with each other, or, a lot of adults play sports in the winter as well. So I think you have to balance, not only, okay, I'm outdoors, that's a good thing, but then can you also keep space, or is this more of a contact sport where you're going to be bumping into people and there's going to be a lot of droplets swirling around your face?
Great. And here's the last question for you, Dr. Althoff, from Adriana Rodriguez of USA Today. What are your plans for the holidays?
So for this Thanksgiving, I'm originally from Iowa. I have a ginormous family in Iowa that I love to visit. But unfortunately this year, that travel is not a risk that I am willing to take. So I will be at home with my kids and my husband. I let my kids pick the meal. So they will be having macaroni and cheese and popcorn, and I will be patronizing a local business here to hopefully prepare a Thanksgiving dinner for my husband and I. I think a lot of people may feel the same way I do as parents, as people who are trying to, keep our economy going and educate our kids and perhaps even fight the virus. It is an exhausting time. So I am really looking forward to holiday season where I can focus on my kids and rest and recharge with my husband, and then connect with my family and friends across the country through webcams, having toasts, saying grace, and having game nights.
Great, thank you so much. And thank you to you both for your presentations and insightful answers. We'll email all audience members the links to the resources mentioned today and share it in the chat. And with that, I'd like to say thank you again to everyone for joining us today.